Good afternoon. Today we're going to talk a little bit about testing for K through 12 schools, as well as some guidance for college as we get a little closer to Thanksgiving. First, I'll give a daily update. Yesterday, the Department of Public Health reported 2,263 cases. The 7-day average positivity rate is 3.25%. 66,000 new tests plus or minus were reported, and over 7.3 million tests have been reported in total since March here in Massachusetts. There are 835 cases currently hospitalized and 159 are in the ICU. The Commonwealth, as everybody knows, continues to see an increase in new cases and hospitalizations as we work our way through a second surge of COVID-19. Since Labor Day, we've seen a sharp increase in COVID cases and hospitalization. Cases are up by 8 times since Labor Day, and hospitalizations are up just over 4 times. The trends obviously are moving in the wrong direction, and this second surge is dangerous for all of us. Big case increases are particularly distressing as we head toward the holiday season, where people traditionally gather in groups to celebrate. This is exactly the type of activity that increases your risk of contracting COVID and your risk of giving it to someone you care about. Our public health data indicates that the majority of our cases are coming from household spread, where transmission can be rapid when people let down their guard. Today, we're urging everybody to make a difficult choice this Thanksgiving. If we treat this year just like we treat every other Thanksgiving, it's quite likely that it will trigger a significant spread. And we know that that leads to serious illness for many, and in rare cases, death, especially among our senior citizens. This virus, as we all know, thrives in indoor social environments where people let down their guard. We saw what happened in Canada following their Thanksgiving in October, where they had a big spike in cases literally almost 2 weeks to the day after their holiday. And we simply can't afford to have that happen here. The Department of Public Health has put out guidance to help plan for a safe celebration. The best way to celebrate Thanksgiving is to only gather with members of your household, the people you live with. Any group gathering beyond this poses a significant chance of spreading the virus. DPH's guidance outlines the risks associated with gathering and has some tips about how important it is to wear masks and how to prepare food and serve it safely. That information is available at mass.gov/Thanksgiving 2020. And as a reminder, our indoor gathering limit is 10 people for private gatherings. I know people are tired of hearing me talk about this stuff, but we are in the midst of a second surge, and it's critical that we take all the necessary steps that are not only designed but proven to keep us healthy. And this is particularly true for families that have grandparents and older relatives that are high risk and could fall critically ill from COVID-19. As a reminder, Massachusetts does have an out-of-state travel restriction in place and a travel policy that all visitors and residents must follow, including college students. If you're traveling from any state in the country, with the exception of Maine, New Hampshire, Vermont, and Hawaii, you must either get a negative test result 72 hours prior to arriving in the Commonwealth or quarantine for 14 days after you get here. Even this list of states could narrow if cases keep rising. And before Thanksgiving, thousands of college students are leaving campus to travel home. With our high concentration of colleges and universities, Massachusetts sees a lot of traffic for students leaving campus and students coming back to Massachusetts from other states. This migration has school officials, state officials, public health experts, municipal officials, and many others very concerned this year because of the COVID-19 pandemic. The Commonwealth has updated our guidance to colleges and universities, advising that any students leaving campus to go home for the holidays should first receive a negative COVID-19 test administered by the college within 72 hours of their planned departure. And if possible, residential colleges should also offer COVID-19 tests to students who live off campus who plan to return home. Testing students before they leave campus will reduce the risk of college students bringing the virus home to other family members during Thanksgiving and the upcoming holiday season. And we're asking colleges and universities to inform all students of the serious risks associated with going home without first receiving a negative COVID-19 test result. If a student does receive a positive test result before they're scheduled to leave campus, they must If a student does receive a positive test result before they're scheduled to leave campus, they need to isolate in campus housing designated for COVID-positive students. Colleges across Massachusetts understand this and are prepared for it. After the holidays, when students return to campus, they need to also produce a negative COVID-19 test result administered within 72 hours of their return to campus. Colleges should administer tests immediately to any student who returns to campus that's not been tested within 72 hours, and testing should apply to all students, whether they live on or off campus. These guidelines, which have been shared with the college community, are designed to ensure students are leaving campus where they are often in communal spaces and with peers, free of the virus. Hopefully, it'll help prevent thousands of students from traveling around the state and over state lines to potentially infect their family members and loved ones with this virus when they return home. The pandemic obviously has brought a tidal wave of challenges to our state, our country, and in fact, the globe. And it's been extremely difficult. People have made huge sacrifices. People have given up on all sorts of things that have been part of their daily routine, and people have lost loved ones along the way. And the virus is going to be with us until there's a vaccine or a treatment. And while there's lots of optimism with respect to the vaccine trials that are currently going on and what that could mean with respect to all that, thanks to the brilliant firms that are working on this, including Massachusetts-based Moderna and Pfizer, we still have a way to go. The vaccines do give us, I think, all real hope on the horizon. But until we get there, everybody still has a responsibility to stop the spread of this highly contagious virus. At this point, we have a broad base of scientific knowledge and several tools at our disposal that are proven to prevent COVID-19 spread and infection. But we have to practice that prevention every day in just about everything we do. Several weeks ago, we announced targeted measures to stop the spread of climbing cases and hospitalizations. Just want to remind people about what those are. Respect the stay-at-home advisory and stay at home between 10 p.m. and 5 a.m. Wear a mask whenever you're out in public and when you're not around members of your household. And avoid social gatherings with people you don't live with. Can't stress this one enough. It's a really significant issue with respect to the spread of COVID, not just here in the Commonwealth of Mass, but around the country. And at this point, folks should be going to school or to work and going home. And if people abide by these very simple rules and concepts and do it consistently, it can allow us to keep everything open, our schools and our economy. And it can give us the kind of holiday season that I think everybody is hoping for. Several scientific studies have shown that COVID transmission in schools is low, even for schools and communities that have higher rates of COVID. The Department of Elementary and Secondary Education has released thousands, probably more like hundreds of pages of guidance, hundreds, that's been endorsed by the American Academy of Pediatrics on how to structure safe in-person learning. And there's a growing body of evidence that the impact on kids not being in school with learning at home is causing other health problems like anxiety, depression, and obesity. In school is the best place for our kids to be. And if for no other reason, folks should take the state's COVID precautions seriously so that our schools can stay open. Businesses are also doing their part to operate under the COVID safety guidelines that were developed earlier this year. And most of our economy is open, and we would like to keep it that way. We can't afford to let the virus progress to a point in time where our hospital system struggles to provide the care that people here in Massachusetts need and expect. People need to act to prevent this from happening. Working, as we talked last week, with MEMA and UMass Memorial, we're in the process of standing up a field hospital that will be available in early December in Worcester. Our administration will continue to devote time and resources to fighting this virus and continuing to focus on access to testing, tracing, and other strategies. In many respects, Massachusetts leads the nation with regard to these efforts. But the best weapon we have to fight this virus is prevention. And every person has the ability to stop the spread by following state guidance. We remain in the midst of a pandemic, and we all need to continue to appreciate the havoc the virus can wreak when it gets into the wrong places at the wrong time, and to follow the public health guidance that we've put in place. Now I'm going to turn the mic over to Secretary Sudders.
I was about to say good afternoon, but I think it's still morning. Good morning, Governor, Commissioner Riley, everyone. So tomorrow, a message from the Department of Public Health Commissioner Monica Burrell will be sent to 4.5 million phone lines across Massachusetts via the Everbridge Resident Connection Alert System, reminding residents of the increased risk of contracting and spreading COVID-19 over the coming holiday season. This is our second message utilizing the Everbridge Alert System. The message is in both Spanish and English. Residents will be reminded of the new measures that are in effect as of November 6th, including limiting private gatherings to 10 people indoors and 25 people outdoors. The alert will also update residents on quarantine orders for visitors from high-risk states. At this time, the only states that are not considered high risk are Hawaii, Vermont, Maine, and New Hampshire. Weekly state travel data is released on Fridays, and everyone is urged to check the website, as we expect 2 of our neighboring states will be added to high-risk states. This alert is also part of a larger campaign to higher-risk communities that includes paid advertising and other communications to remind residents that the pandemic is still with us, and these best practices help protect families, friends, and neighbors. Residents can choose to receive future messages by text, email, or phone in their preferred language by opting in at mass.gov/COVID alerts. As the governor has continued to impress over these past few weeks, COVID-19 cases are on the rise across the Commonwealth. The uptick in cases also means there's increased exposure to COVID. The Department of Public Health has issued new quarantine guidance that takes effect today. While the initial guidance to quarantine for 14 days after exposure still stands, this update allows those who have been exposed to COVID to test out of quarantine after 10 days if they meet all of the following parameters. 1, they have not had and do not have any symptoms similar to COVID. 2nd, they get tested on day 8 of their quarantine period or later using a molecular diagnostic test, the PCR test, and receive a negative test result. And thirdly, they must continue to monitor themselves for symptoms for the full 14 days. Any individual that develops symptoms should contact their local healthcare provider and be retested. While there has been no change to COVID-19 travel orders, the directives are worthy of repeating as families plan their Thanksgiving holidays. All visitors entering Massachusetts, including returning residents who do not meet an exemption, are required to complete the Massachusetts travel form prior to arrival, unless you're visiting from a lower risk state. You must quarantine for 14 days or produce a negative COVID-19 test result that's been administered up to 72 hours prior to your arrival. If your COVID-19 test result has not been received prior to arrival, visitors and residents must quarantine until their negative test result. Full information and guidance for persons in quarantine due to COVID-19 obviously can be found at mass.gov/COVID-19. It's worth reiterating what the governor has said about Thanksgiving. As you plan for the Thanksgiving holiday, do your part to keep your friends, families, and communities safe during COVID-19. If you host a holiday celebration, keep it very small. Limit in-person holiday gatherings to only people you live with, or limit to a small group of individuals with whom are part of your bubble. Anytime you're near people you don't live with, be certain to wear a mask when not eating or drinking, wash your hands often with soap and water, and stay at least 6 feet apart. Consider if those around you might be at higher risk of severe illness from COVID, such as older adults or those with certain medical conditions, and take extra precautions. If gathering indoors, improve ventilation by opening windows and doors. Keep visits short. Gatherings that last longer pose more risk than shorter ones. Avoid sharing food and drinks. Avoid shaking hands and hugging. Avoid singing, dance, and shouting. I know there's a lot of avoids in this. These activities increase your chances of catching COVID through the air. I know that for many families across the state, this guidance dramatically impacts long-standing family traditions and is devoid of human interaction we have all been missing since March. But it's crucial that we follow Department of Public Health and CDC guidance to help stop the spread of COVID-19 in our communities. Before I turn it over to Commissioner Riley, I just want to give a brief update on the Binax Now validation study. And as I do this, I want to give a shout out to Dr. Smalley and the group at the Department of Public Health, because they actually led the study. The Department of Public Health recently completed a study to compare the rapid point-of-care Abbott Binax Now test to the PCR test, which, as you know, is the gold standard for detecting COVID-19. The Abbott Binax Now rapid test is a simple, quick, inexpensive test that produces results in approximately 15 minutes. The Department of Public Health collaborated with Lawrence General Hospital, Boston Children's Hospital, and the Broad Institute to enroll over 1,600 individuals between October 26th and November 12th at the Lawrence Community COVID-19 Testing Center, which is a state-supported Stop the Spread site. 2 nasal swabs from each participant who volunteered for the study were collected for testing by the Binax Now rapid test and the PCR test, performed in parallel. Individuals were also asked to report on the presence or absence of COVID-19 symptoms within the last week or so. The Binax Now rapid test was able to successfully detect COVID-19 in children and young people 79% of the time, and in adults 97% of the time, if they had reported symptoms within the last week. Only 5 Binax Now tests during the entire study produced a false positive result, where the antigen test incorrectly indicated the presence of COVID-19 when the PCR test was negative. This happened in 3 out of every 1,000 people and is considered a very low rate for a rapid test. We are very encouraged by this as we roll out the Abbott Binax surveillance across the Commonwealth. And with that, I'll turn it over to Commissioner Riley.
Good morning, everyone. Districts in Massachusetts have carefully implemented sound health protocols developed by DESE and DPH in consultation with medical experts, and these appear to have had a significant positive effect on safety for students and staff. And we continue to stand up additional measures to mitigate virus spread in schools. We are now ready to launch the first phase of a COVID-19 testing initiative in schools, which will be used for students and staff showing symptoms. Massachusetts received Abbott Binax Now tests from the federal government, some of which will be used in public school districts, charter schools, and other educational settings. DESE, in collaboration with DPH, is introducing phase 1 of this testing initiative at 134 public school districts, charters, and special education collaboratives in early December. This is a voluntary initiative with test kits provided to schools at no cost and designed to help schools continue to provide in-person instruction. Schools chosen for phase 1 need to meet 6 criteria, including the ability to complete DPH reporting requirements and ensure staff who administer the tests are trained. Schools must also obtain parent-guardian consent prior to administering tests to students. The Abbott Binax Now test is a rapid antigen test Rapid antigen tests perform best when the person is tested in the early stages of infection, which is when the viral load is generally highest. Under federal guidelines at this time, the Abbott Spinex Now test is not to be used for broad-scale asymptomatic in schools, and students, parents, and staff should be aware that an antigen test results are not considered at this time diagnostic. Results are probable, and confirmation of a person's COVID-19 status requires a PCR test. As we have said many times, staff and students must stay home if they are not feeling well. However, some people may experience the onset of symptoms while at school. The Abbott Spinex Now test will allow schools and districts to rapidly respond to these type of situations. By testing students and teachers and getting results within minutes, we will be able to identify infected individuals and their close contacts more quickly and to help stop any spread. It has become increasingly clear that this virus is going to be with us for a while. Even though the news is promising and incredibly optimistic about the vaccines, it is unlikely that it will be ready to be administered to children during this academic year. As such, we cannot wait for a vaccine to be widely available before our kids continue to stay in school. We've created ways to safely return to school through our extensive health and safety guidance that was endorsed by the Massachusetts chapter of the American Academy of Pediatrics, nearly $1 billion in funding to schools for COVID-related expenses, setting up the DESE Rapid Response Help Center for districts, and now new opportunities for COVID testing. With these measures in place and evidence that schools can operate safely for in-person learning, we need to continue to work hard to keep as many students in school learning as possible. Thank you.
Can you tell me a little bit more about how it works? So if a child comes down with symptoms while at school, then you do the rapid test, and then do the contacts get rapid tests as well? Just trying to understand.
Right. So at this time, and this may change based on what Secretary Sutters was talking about, some of the testing done at Lawrence General. At this time, this test allows anyone with an onset of symptoms at school to be rapidly tested. And we can find out those results in minutes. As we're saying, it does not guarantee at this time they're COVID positive, but if it shows positive, they have to go get a PCR test, which will then tell us. But this will, for schools, allow us to more quickly move to identify close contacts if we have a probable positive on one of these tests.
How much evidence do you have of COVID transmission at school? Is there any?
I don't know if we can confirm that we've seen any. It's incredibly limited. I don't know if the DPH folks have verified it, but it seems like and this is not just here, right? This is across the world, across the country, and here, but the policies we've particularly put in place around masking, distancing, and hand washing are really helping keep those numbers limited.
Will parents have to give pre-authorization for the testing? Or
Yes, that's one of the 6 conditions is the parents have to sign off for their kids to be able to be tested.
Is there a threshold, like you need at least 70 or 80% of parents and guardians to consent, or not?
I don't think so. You know, we hope that parents will consent for the testing, but I don't think we've set up a threshold for that.
Commissioner, can you talk about what kind of schools you're looking for, the 134?
So we have a broad mix of schools. It was a voluntary process, and we've identified schools, and we asked them to kind of meet these 6 requirements. And so we're in the process of finalizing that list. But we are ready to go for early December with the rollout. Yeah, it was put out to all districts, and then we've kind of said, can you meet these 6 criteria? And so the list will. We did a webinar, yeah, and so the list will go up and down. Yeah.
Commissioner, if this is phase 1, what are the other phases? And is there a point where you would do weekly tests of just asymptomatic students and staff as well?
Yeah, so this is phase 1. This is getting the process started. As we continue to get more tests in from the federal government, we'll release those too. This will give us good information as we begin to finalize the data from Lawrence General to see if we change how these tests are used. And so there could be a change in phase 2, for instance. But for now, we're getting the process started.
Gotcha. But any plans for asymptomatic testing of just like weekly for all students, as some schools are doing at least 2 at the same time?
No, this is the process we're using at this time. But again, these things are subject to change.
There have been some reports of the CDC pulling quietly some materials promoting in-person learning. Are you aware of that? And what do you make of some of those some of those changes. Have your thoughts about in-person learning changed at all?
I mean, I guess what I would say is we're relying mostly on the medical expertise here in Massachusetts. We certainly look at the CDC guidance, but as you know, the CDC guidance has changed for different things over time. And so there's been some up and down, back and forth about what they put out. We're relying mostly on our medical community here to advise us on what we're trying to do.
And given the uptick of those cases, there's no chance that, like with private gatherings or anything else, that might lead to some concern over in-person learning because of upticks elsewhere?
Yeah, I mean, listen, I mean, I can't restate the governor's points enough that we really need people to redouble their efforts around preventing the spread of this virus. What we see in schools and what we've seen already in some places is we don't think transmission's happening in schools, but that doesn't mean that kids or teachers aren't bringing a positive case into schools. And when you do that, you have close contacts, which means you have to put students or staff out. And we've seen in some cases where a certain number of staff have had to be put out on quarantine until they're cleared, and that's forced a school to shut down. The classic example is the high school parties, where if the local authorities can't identify who the kids are, some of these high schools have had to shut down for remote instruction for as short a period of time while they wait to see what happens in their community. And just to go back to the beginning, DESE at the very beginning of all this really asked districts to create 3 plans. One for remote, one for hybrid, and one for fully in person, because we think that schools may have to shift amongst these models throughout the year. Now, the hope is that maybe later in the spring we could shift towards more in person if the vaccine gets rolled out and we're able to get our virus spread way down. But for right now, with the numbers going up, some districts may have to shift to remote if the cases go up, even if there's no spread in the schools.
Secretary Sutters had mentioned about the rapid tests, a very small false positive. Any data on false negatives?
Oh, actually, no. Hold on. Give me my glasses. Both the sensitivity. So both the test sensitivity and the test specificity was much. One of the reasons. Let me back up. One of the reasons when we got the Abbott Binax test that we decided to do a validation study was to literally, like, how does a PCR and the Abbott Binax measure up? So both on sensitivity and specificity, which is right, sensitivity is the true positive and specificity on the true negative. We were very pleased with the results across 1,600 tests. And I'll have to go through my notes to give you actually what the actual percentage was. We're going to post the data because it's also the first time that we're aware of that actually the test was for both kids and adults. So we feel comfortable about using this on particularly asymptomatic, so early symptomatic kids and adults. You can pick up COVID-19 pretty within 15 minutes. And what you want to do, just to get back to your question, which is if a kid came to school with any symptoms, or an adult, right, any like cold or whatever, this is a rapid test, 15 minutes, and it will give you a very strong sense, a probable, of whether the kid has COVID or not, or has something else going on like a flu. And you send them home, right, so that you don't have transmission coming into school. And that's really what this will be very useful for.
Governor, you had mentioned yesterday that this Abbott rapid test could be a game changer, right? And we're going to get a few million doses. At what point can we go to CVS and buy one of these things and test ourselves?
So one of the reasons this test is being used the way we're using it here, which is basically I'm going to get there, okay? But one of the reasons this is thought of as a symptomatic test is because it's not approved by the FDA yet for asymptomatic purposes. So keep in mind that the way we use these, for the most part, is driven by federal guidance. And while there are a number of tests that are currently in development to make it possible for you to buy them in a store. And this part of what makes me so optimistic about this Binex test, first of all, the results up against a PCR test with a pretty big sample size turned out to be very good on both true positives and true negatives and false positives and false negatives. The second thing is it's a $5 test, okay? And it is really easy to use. I mean, I can't express that part enough. I mean, basically, you fold it open like this, and it's sort of the size of 2 playing cards, and you take the swab and you stick it into like a little plastic tube on here, which is glued to the paper. You close it, and you wait 15 minutes, and on the outside here, you get an answer that's either black or pink. And if it's pink, it's positive. If it's black, it's negative in 15 minutes. And it's really easy to use, and it's not very expensive. And I think one of the things that will happen here is a lot of people will use them in a lot of different settings. We're going to use them in schools. We'll probably use some of them in correctional facilities and other places. Other folks are using them in long-term care, congregate care operations. We're going to collect a lot of data on these in a fairly short period of time, which I believe will be helpful with respect to how they might ultimately become available for surveillance testing, which is kind of where you're going, Jonathan. You know, when are we going to get to the point where we could buy something for $5, buy 10 of them, stick them in the, stick them at home, and as long as we follow the directions, get the result of the test. And the other thing, by the way, you can do when you get a result from one of these Abbott tests is you can hold it up to your phone, and it will actually ping your phone as a positive or a negative, which then makes it really useful for things like work and other sort of out-of-the-home type activities.
So are you hopeful this spring, perhaps, we would see widespread
Oh,
use?
I would hope to see this. My hope would be to see it before the spring, yeah. I mean, remember, the feds bought basically the entire production run between now and the end of the calendar year. I think they bought 150 million of them. Is that right? So, coming behind that will be what I would call sort of a production run that would be available more broadly to states and to the public. But because the feds bought so much of this, and because people are deploying them in a variety of ways, there's going to be a lot of information about their accuracy and their effectiveness that's going to churn up over a pretty short period of time, and I think that's going to be a good thing.
And Governor, would the test only be used for students who show symptoms? Like if there's a party in town, you wouldn't use it to screen out people who could have been at that party. You have to have a symptom, and if it comes up black, they have a cough.
Well, right now they're only approved by the federal. The test itself is only approved by the federal government to be used for people who are either close contacts or have symptoms. Right?
But our school system.
No, it's not self-administered, but that could change too, right?
The other point I would just say is the future. So this is also not a self-administered test. So you do have to have someone who's been trained to do it's the short swab. That is also good news about this. Is it's not the long swab. The future is self-administered, inexpensive tests that people would have at home, sort of like the strip tests. That I think there's a lot in production. They're not available yet. There was one approved, I think, last night as a UA, which was the first self-administered test at home. The price point of that is prohibitive for people. It'll probably be about $50. But that is sort of the future until such time you have a widely available vaccine.
No, the other thing I was confused about, if the student has any symptom, why would they be able to stay in the school if it came up black?
So again, the idea is, the concept is if a child had any, like a cold, runny nose, a fever, you would give them the test. It has a very high sensitivity for COVID positive. And then if it was a COVID negative and the child had still like runny nose or whatever, you may make the decision to send them home. Definitely if it comes out positive, the child's going home. Right. And if it's negative, if it's like a tiny cold, you might leave them in school, but otherwise you'd send them home and go have a PCR test. What you're trying to do is, as Commissioner Riley said and the governor, you're trying to contain any potential transmission in the school. And it's rapid, it's easy, no mess. But there are these requirements because you do need to have a physician's order, so we'd have a standing order for it. So it's not over the counter. This is not yet over the counter. So you have to have a standing order by a physician. You have to have someone who administers it. It could be a med tech, but it's very easy to administer. And I think the fact that there's 134 schools, collaboratives, and private residential schools, you're clearly looking to be able to triage kids.
So who will be administering them at the schools? Is it a med tech or is it someone?
Like a school nurse, med tech, they could have a relationship with a provider or the like. Yep.
Secretary Sutters. Quick question for you. Secretary Sutters, since these tests are, a little bit further out, are we doing anything right now to expand testing locations? We're seeing super long lines. Is there anything being done in the interim to improve that?
Do you want to take this? Or he likes this question.
So, I've watched a bunch of the news reports on the lines, and we've also talked to some of the folks who are doing the testing, and in some respects, the comments that a lot of the people made that were in the line indicated that a lot of folks aren't paying much attention to my guidance with respect to the holidays, because a huge piece of the commentary associated with why the lines are long is that people want to get the test before they go somewhere for the holiday, or they want to get the test because they have somebody coming home for the holiday. We have always said that if you have close contact, or you think you might be positive, or you're concerned about your situation and circumstance, go get a test, which is why we set these free sites up. The second thing I would say is 96% of the population in Massachusetts has health insurance. CVS, Walgreens, all the pharmacies have open slots available right now that people could fill and get those tests done at the pharmacies, and those would be covered by insurance with no out-of-pocket expense. We have 250 test sites, and at the vast majority of them, the Commonwealth of Mass, right now, if you have insurance, which most people in the vast majority of people in Massachusetts do, those sites are open and available to people. I think there are 18 Stop the Spread sites. They're free, but they are not the only place people can go to get a test without paying out of pocket for it, given the circumstances and the situation. But I was struck by how many of the people on a lot of the news shows said that they were getting a test because they were traveling for the holiday. I think it's great that they chose to get a test, okay? But the bottom line is that means they're positive or negative today, okay? The whole reason we've talked about prevention as being a strategy that has to do with who you spend time with, and whether or not you wear a mask, and whether or not you keep distant, and whether or not you engage in the hygiene that's been talked about, is because that is the whole ball of wax that's associated with protecting yourselves and protecting others. Getting that test, we have requirements in place. We want the schools to test kids before they leave. We made very clear to the colleges, kids got to get a test before they leave, kids got to get a test when they get back. That's why we spent a lot of money with the Broad Institute and with others to set up a very big and very comprehensive testing apparatus that our colleges and universities could use on behalf of their staff and their students for a relatively small amount of money on a per test basis. That was part of the plan. But part of what I'm concerned about here is it's pretty clear based on those lines that a lot of people are going to travel over the holidays. And there's not much at this point that we can do other than say we think that's not a great idea, and to urge people, if they do that, to recognize and understand that a test is not, a Kevlar vest, okay? It's a moment in time. And it's going to be really important for people, if they travel, to wear the mask, maintain distance, and I'm sure the rituals of coming home from school have not changed very much since I was in school. When I would come home from school, I would see my family, and I would go visit all of my friends who were home from all over the place. And I'm pretty sure, since I have 3 kids in my 20s, I watched all them do, in their 20s, I watched all them do the same thing too. I can't express how bad that is as an idea with respect to managing COVID and managing spread, unless people are serious about wearing a mask and maintaining distance when they do that type of thing. And we have a perfect example of what happens when people don't pay attention to these rules and treat this Thanksgiving just like any other. And it's just north of us in Canada.
Governor, could I ask you about Attorney General Healy's announcement that she's got a $550,000 settlement from her company that sold apparently ineffective hand sanitizer to the T? Did the T do enough due diligence? Because there are posters saying this product does not contain alcohol. Are you concerned at all about this issue?
The T's been working with the AG's office on that case. And we were very happy to see the result that was achieved by the Attorney General because of the misrepresentation that was involved.
Governor, have you
did
had
the
a
T-
chance
Quick update on vaccine distribution. Some of
Say
the
again?
Quick update on vaccine distribution. Some of them will require extremely cold temperatures. We got good news about the Pfizer vaccine today. It's more effective than it is the thought, but it's the one that requires super cold temperatures. Specifically, how many super cold freezers will Massachusetts need, and how many do we have today?
So there's a fairly extensive process that's going on with respect to vaccine distribution between the federal government and the states, and I would call it very much a work in progress. What I would say is that the virus as it's currently being, or the vaccine as it's currently being discussed, would be shipped in containers, and those containers would carry the vaccine at the price, or at the temperature point that's associated with what it needs to be at before it gets distributed. And the goal here on the part of folks like us is going to be to make sure that it gets distributed in a relatively brisk and prompt fashion so that the device it comes in ends up being, for the most part, pretty adequate with respect to dealing with the issues associated with the temperature that's required to sustain it.
Governor,
Governor, have you
have you
read-
had a chance to review Andrew Lelling's report about what's going on at DOC? How do you intend to address those concerns, and who will be overseeing that?
So the report came out yesterday, so obviously there have been a fair amount of conversations among our folks over the last 18 hours or so. What I would say is that we are going to implement every recommendation that's in there. A lot of that stuff that he recommends and his folks recommended came out of dialogue and conversation that's taken place with DOC over the course of the investigation. The folks from Health and Human Services and Mary Lou Sutter's shop are going to be deeply involved in this. And while we have focused real hard on a bunch of different things associated with DOC over the course of the past few years around criminal justice reform, managing COVID, and dealing with Bridgewater State Hospital, this is a fail that needs to get fixed.
Any concerns about Norwell? Their school committee announced that maybe they were going to go till 2022 with all of them. Or other schools similar, where we know your messaging.
Have you heard anybody else say anything like that?
The school committee had discussed it last night about not doing full in-person until 2022.
Well, I've made pretty clear that I think kids need to be in school. And I think if you talk to almost anybody in the pediatric community, they'll tell you that the consequences, the very negative, very real, and in some cases sustained consequences of the isolation and the lack of rhythm and the lack of socialization and the lack of engagement with their peers and with their teachers on a regular basis is an enormous public health threat and potential calamity. So I think it's critically important for all of us to recognize and understand this and to follow the guidance that's been developed and to do everything we possibly can to serve kids in person. And I'm shocked, frankly, and disappointed that a school district at this point in time we've basically been writing off the rest of the year, given that there's a lot that can happen between now and June.
Do you still intend to have Massachusetts participate in TCI, or there should be a memo of understanding coming out soon?
Yeah,
Where
I
do we
mean,
stand on that?
there's a lot going on between and among all the states that have been part of that conversation. I'm still very much a fan, but as I said yesterday in answer to another question, there's a lot that's changed about transportation generally over the course of the past 8 months, and that stuff's got to get baked into the way people model what this would mean and how it would work going forward for them, which, changing circumstances, that makes sense.
Governor, still no plans for any new restrictions with Boston's mayor not ruling out another shutdown? Wondering where your head's at.
Well, we issued a series of reforms and adjustments to our existing rules about 10 days ago, and we said at that point in time that the way we track this is over 3 weeks of data, which is actually 4 weeks of information, which is where we are and how we're thinking about it. The one point I would make to people, people keep saying that we have 2,000 cases now daily that we discover, which is the same as the 2,000 cases we discovered on a daily basis back in the spring. In the spring, those 2,000 cases were very sick people for the most part. We weren't doing that many tests back in April and May. And the rules under federal guidelines associated with how you could get a test set the bar really high. So if you got a test, you probably had symptoms and at least one or two other things that were associated with why you were getting the test. And as a result, there were a lot of people, and there have been studies done on this, there were a lot of people, not just in Massachusetts, but in other places, who actually got the virus, got a low dose of it, never got tested, and were never determined to be part of that community. And some people have estimated that back in the spring, we probably got 1 of every 15 people who got the virus, or 1 of every 20 people who got the virus. People say with the amount of testing we're doing now and the open door and availability that's associated with it, we're probably getting 1 in 4, maybe higher, depending upon the assumptions people make. And we are picking up an enormous number of people who have very limited symptoms, or in some cases, no symptoms at all. So that 2,000 cases in the spring was a much different 2,000 cases than the 2,000 cases we're getting today. These folks were very sick, and the vast majority of them ended up in the hospital, okay? Remember, we've had double the case increase because of the open door policy we've established as the national leader in per capita testing over the course of the summer and into the fall, and an increase in hospitalization that's half that rate. And I think that speaks to the fact that the people who are testing positive are a much different community than the people who were testing positive back in the spring.
Governor,
Thanks.
Congresswoman Clark was elected assistant speaker while you were speaking. Your thoughts on that? Is that good for Massachusetts?
Well, I think anytime you have people in leadership in the federal government, that's good for Massachusetts. Congratulations to the Congresswoman. I mean, let's face it, I spent a lot of time over the course of the past year or so talking on a regular basis with Congressman Lynch, who's got a lead seat on one of the Armed Services subcommittees, and Congressman Neal, who's the House Chair of the Ways and Means Committee, because those roles really matter. And when Congresswoman Nikki Tsongas was in Congress, her seat on the Armed Services Committee was incredibly important to a lot of the work we did with our military task force in Massachusetts. And Senator Warren's seat on the Armed Services Committee in the Senate made an enormous difference in helping us advocate for things like what I would call sort of the modernization of Lincoln Labs, which is really good for national defense, but it's also really good for the Commonwealth. So that's always a good thing. I mean, the GLX project, which is on its way, it's on time, by the way, and pretty much on budget. Part of what made that project possible was Representative Congressman Capuano's seat on the Transportation Committee and in leadership, which generated $1 billion in federal money to go in alongside $1 billion from the Commonwealth and $300 million from the communities that were benefiting from it. So there are real advantages to having people in leadership in Washington. Yeah, thanks.
Thanks.